Today it is basically an intro and a few definitions we need to go on, because a lot of times women just broadly say menopause, and menopause is just one point in time as the questions ask. Then you have definitions for before and after. So we just run through that quickly. And I'll just list some of the factors that may affect the age at which you experience menopause. We'll go through some of the symptoms, how you diagnose menopause, and basically menopause management. Menopause management is the longest part. We'll go through lifestyle changes. We'll go through talking about some of the supplements, pharmacologic management. So I'm going to try and get through all of that. Okay. Oops. All right, so menopause is that one point in a continuum of life stages in a woman's life. And hold on, let me just. Ooh. All right, hold on. Right. And it marks the end of reproductive years. After menopause, a woman is not able to produce unless she does it artificially, right, for special fertility purposes, with artificial insemination or any other artificial reproductive technology. So basically, menopause can be divided, or there are different types of menopause. There's natural menopause, where there is decrease in ovarian function, right? And a decline in the blood hormone levels. That is a normal aging process. Now, you may have had a hysterectomy, which then is surgical menopause. And of course, that can occur before the age of menopause. You guys talked about the age a minute ago. And then there's induced menopause. Some women with medical illnesses, diabetes, had cancer and has been on chemo, anyone who's on dialysis with kidney disease, these patients with autoimmune diseases, these patients can experience induced menopause caused by premature ovarian failure, which is caused by any of these conditions. Next. So these are the stages of the menopause. As we mentioned, it's a menopause transition. Okay. So, and then some of the symptoms overlap. All right. So now here you have normal ovarian function. All your hormones are acting properly. Well, of course, unless you have a hormonal imbalance in patients with PCO, polycystic ovarian syndrome, and any other hormonal imbalance. But basically, you have normal hormonal function. You see your periods practically around the same time every month. If you had your periods normally 5 days every month, certain amount of bleeding, and then it lightens. So basically, you have the normal hormonal function. Then around perimenopause, which can occur anywhere from the age of 40 onward. things start to change, your hormonal levels start to waver. Sometimes it's up, sometimes it's down. And a lot of the symptoms of menopause occurs in the perimenopausal period. So perimenopausal period is the time before menopause. And remember, menopause is when you've had no menses for 12 consecutive months. All right. I had a patient, she was going good, she was excited. Yeah, I almost there, I almost there. And at the 11th month, a period came. I was like all over. So you have to have 12 completed consecutive no periods. So some people say menopause, but that's just at that point when you reach your 12th month at the same day, that is menopause. Premenopause is the time before that, from the age of 40 to that point. And that, of course, it varies. And then postmenopause occurs right after. Okay, so for women who stop their periods for 12 months, I mean, doesn't have a period for 12, normal, and you should be investigated for postmenopausal bleeding. Okay, so the perimenopausal period is where all of the symptoms is different. And so in the beginning, she may just have a few hot flashes, nothing too much, she can handle it. As years go on, she may start to have a lot of the symptoms, but a lot of this depends on several factors, and I'll mention those later. And of course, like I mentioned, postmenopause is that after your periods have stopped. Next. Okay, so again, stages of menopause. Stage one is the first stage in the menopause transition, starts with P and ends at perimenopause, usually between the year 5, but you can go up to 40. 40 is where your perimenopausal stage is. And this is the time right before menopause. Again, I mentioned all of this. Now, the stages, the third stage is menopause, point at which, again, I just mentioned that you can no longer get pregnant. Now, the thing is with that, let me go back, is that women who were on, let's say, an IUD for abnormal bleeding, or a woman who may have been on the pill, because during that perimenopausal period, you can still get pregnant. If the hormone level is high enough, you can still get pregnant. So for those women who are not on birth control, they could get catch, right? So they can get a pregnancy during that time. So it's difficult for women who are on the pill, especially those who may be on the pill where they may not see a period every month. All right. Or they may have an IUD where it's difficult, the bleeding, when they actually stop, it's difficult to determine. That can prove to be a little problem, and they may not be able to track whether they're actually in menopause. So a lot of people ask me, so when is the end? When is the start? When is the end? I mean, how should I expect? I'm nearing age 40. Do I have it? The age varies. There's no specific age at which menopause will begin. But for patients who had, and I'll go over some of the factors in a minute, but take, for instance, if you started your periods early, then you may have menopause a little earlier. So in the United States, according to the American College of Obstetrics and Gynecology, menopause begins on average at the age of 51. But they said, according to NAMS, the North American Menopausal Society, they say it could range anywhere from 30 to 60. I thought that was interesting. But in the Bahamas, a study was done by Dr. Bo et al. In an evaluation of sexual dysfunction in postmenopausal women in 2016. She found that the average age of women in the Bahamas for menopause was 50 years, but the age range anywhere from 46 to 52. So again, it varies. And the factors that determine the age at which menopause will begin is genetics. So a lot of times I ask my patients, I said, is your mom still alive? Your sisters? Find out when they went through menopause. And that's around the time you may went through menopause. Black women tend to go through menopause earlier than white, than Caucasian women. And I mentioned earlier the age at when you first started your periods. If you started earlier, then your menopause will be earlier. If you had your menarche or you started your menses at 16, then you may go a little further past the age of 50. And again, lifestyle. Anyone who smokes or drink alcohol, these tend to develop menopause a little earlier than the average. And of course, diets high in fats and cholesterol and that type of thing. And those who don't exercise may develop menopause earlier. Women who have a high BMI may develop menopause a little early. Of course, patients, as I mentioned earlier, with certain medical illnesses or certain medications, or like I said, if they were having any type of chemotherapy, these patients may tend to develop menopause a little earlier. So I don't know if any of you remember this this from high school, but this is the menstrual cycle. And for those of you who may not remember, the main hormones during your menstrual cycle are the estrogens and progesterones. So the estrogens are the hormones that dominate is the hormone that dominates the follicular phase, or the phase prior to ovulation. And then the phase after ovulation is dominated by progesterone. Now, a lot of times when we talk about menopause, we tend to talk about estrogens and progesterones with respect to the menstrual cycle. And sometimes one of the presentations that you may be in perimenopause is that your periods start acting stupid. Right? So you tend to, you may say, well, I had a normal period up until, that's what I wait to hear, up until so-and-so. And then my ears perk up and I was like, okay, maybe she may be going through menopause. Or like I said, any woman who has abnormal periods, either whether it's have to exclude cancer. Now, let me tell you that again, ladies, because I work in the area of gynae-oncology at the Princess Margaret Hospital, and I deal with cancers, female cancers, throughout the whole genital tract, from the ovaries straight down to the vulva. All right. And most of the gynecologic cancers present with abnormal bleeding. So a lady comes in and mentions that her cycle has changed. The first thing I'm going to want to exclude is a cancer. So I want to sample your uterus. I want to do an ultrasound to look at ovaries. I want to do your pap smear or look at anything related to the cervix. So I'm investigating straight down. All right. All of those are normal. Then I'm going to look at things like your thyroid function. That also, a hypothyroid and hyperthyroid patient could present abnormal bleeding. All right. So I need to exclude all of these different things before I say, okay, I think she's perimenopausal. So come into my office, be prepared for a lot of tests because I need to exclude everything, and I need to exclude cancer first and foremost. All right. So the estrogens and the progesterones are the two main hormones that we look at. But there's also one other hormone that can produce symptoms of perimenopause and menopause. And that's not listed here, but it is testosterone. Yes, ladies, women do produce testosterone, not in large levels like men do, but we do, and we need it. There are testosterone receptors over all of the body. There are estrogen receptors all over the body from head to toe, and there are progesterone receptors all over the body from head to toe. And we'll go into that when we look at the symptoms and so forth. So what are some of the symptoms? This is a list of symptoms. And you can go through that. Like common ones are irregular periods, the hot flashes, the night sweats. There are some uncommon symptoms that women aren't aware of, like over your skin, your feet start getting numb, you're moody as hell, and all of these things are symptoms of menopause. Okay, and I don't want to go through all of them, but most of these symptoms are related to either estrogens, progesterones, testosterone. Okay. So how do I know when I'm in menopause? Diagnosing menopause basically is clinical need. All right. A lot of women may, no, not a lot, but I've had a few women come and say, well, you can't do no blood test. Well, we can do the FSH levels. The problem is in the perimenopausal period, your hormones are doing this. So if we catch you up on the swing, your FSH levels may be normal. So that don't help me, right? So if you're anywhere from 40 to 55 or 50, I'm thinking of menopause. If you give a history of no periods, I'm thinking of menopause. If you give me your history of abnormal periods prior to not having any menses for 12 months, then you're in perimenopause. And of course, the presence of some of those symptoms that I listed above. Okay? So how do we manage menopause? First of all, we need to educate. We need to make some lifestyle changes. Don't forget your annuals. All right, screening is very important, and it's more important for the complications of menopause. Like we have estrogen receptors in the heart. Once estrogen goes, normally women are protected from heart attacks because of our hormones. So the rate of men having heart attacks to women is higher. But when you go through menopause now, we start to get equal to men and we pass them. Why? Because the hormones are gone. We have a risk of fall fractures because bone density is different due to the loss of hormones. All right, so some of us develop osteoporosis, and then there are other complications which were mentioned in the symptoms, like you may have urinary incontinence. I've had several women come into my office. Oh, I feel a bulge in the vagina. Oh, I'm wetting up myself. Those are also complications or symptoms of menopause. Okay, and as a result of your hormones decreasing. And of course, we're going to talk a little bit about supplements. There are a whole bunch of supplements out there. Not all of them have been proven, but women have used them and they are swear by them. All right. And then there are pharmacologic measures such as hormonal and non-hormonal measures. Okay, so in terms of educating, read anything you can get on menopause. All right. Media, social media, go forums like this, podcasts, my Facebook groups, my anger line, my Facebook. Was I off? Wow. Okay.
We can hear you.
Hello. Can anyone hear me?
Yes, we can
Oh,
hear you.
okay.
I think your
Okay,
presentation
because
got
the whole
bumped
starting
out.
over again. Okay, hold on. Yes. So forums like this in my Facebook group, people just seem to want to get knowledge. They don't, and I'm gonna say definitely women are very hush hush and quiet about this, right? There's no need. Come in the group, talk, ask questions, all right, and then you confirm with your physician, all right. But I had a lady come in my office and she's like, I don't want my husband to touch me. It just touches bother me. And it's only us. And then she goes on, I don't enjoy sex anymore. And she's whispering. So like everybody want to stay hush hush about it. It's time to talk about it. It's time to get together and give information. All right. No time. This, I don't need women to there was I forgot the amount, but there was said where they say the highest amount of divorces occur during this period. All right. A lot of things occur and there's no communication. All right. So build communicate with your provider. If your provider just say, oh, it's just a period in your life, just do. It's probably a man. So change your provider. All right. You need to be with somebody you can link with, and that's gonna talk with friends, talk with your family members, find out about their experience with menopause. Okay, what's happening now? It's not advancing. Hold on a second. Okay, so now diet is important. Make sure you hydrate. Lifestyle, smooth menopausal transition, or it's me to screen for menopause, to find out what they're experiencing. And the first thing I ask them in their consultation, what's your diet like? All right. Now it's good to adopt a nutrient dense diet or even an anti-inflammatory fiber and vegetables, low glycemic fruits, healthy fats, fish. Okay, a lot of Bahamians love fast food. Wrong. That's the worst thing for menopause. All right, it may satisfy for the time, but it's not the best diet. Hydrate yourself. Cells and hormones and everything, how our body functions on hydration, water. And I don't mean hydrate with soda or juice. And 100% juice is not juice. All right. Reduce the refined sugars, all of the things that are high in sugars, take them out. Dairy, processed food, take them out. Caffeine, reduce it, limit it. Alcohol, high in sugar, reduce it. Quit smoking. And for those who, all of these lifestyle changes are important. Exercise is very important. Try to maintain a healthy weight is paramount. Now, I know everyone say, man, menopause, I just put weight on me, right? But I had a friend of mine who say, I don't know, I never used to eat like this. I want to snack with chocolates and chips and all right, so you have to be cognizant of what you're eating, and you literally have to choose, okay, the carrot sticks or the chocolate. I'm guilty too. I get my little cravings also. And aim at about you don't have to, all right, you have the week. All right, use some of the night time to sleep. You at least four times a week is sufficient. Okay, and women with menopause, You should do more weight-bearing exercises, walking, dancing, strength training, and strength and interval training is also good with weights or resistant bands if you can't lift too much weights. Cycling and Pilates, all of those are very good for your heart, for your bones. Yoga, swimming, these are some of the it ain't the aerobics with the jumping, jumping, jump. Your knees and your bones may not be able to handle it. All right. So you have to choose wisely. All right. And you don't have to exercise as much as some of us do. Okay. That is so important. And how do we do that? Um, we have to improve your quality of sleep. Try to meditate, however, pray or just sit on the beach and sunrise or sunset. That's important to activate the parasympathetic nervous system. So in for 4, hold for 4, out for 6, and then pause before you go again. Outside exercising is good. Hiking, it helps with the vitamin D, which helps with mood, which helps with your bones. And vitamin D also boosts serotonin levels and oxytocin, and these are hormones or neurotransmitters that help with happiness. So that reduces stress. Sex, ladies, believe it or not, that helps to reduce stress. All right, so let's get sexing, right? And sound wave therapy, vagal nerve stimulation. And of course, we're going to talk a bit about supplements, but one of the good supplements is the ashwagandha. Okay, so, and you can research other calming supplements that can help in reducing stress. Sleep. All right, one of the presentation ways women present in perimenopause and menopause is they can't sleep. They're up all night. We should be getting about 7 to 8 hours sleep. See, I have a nice watch here that has tracked my sleep, and I thought I used to sleep well. I only get about 5 hours sleep, which is still not enough. But I thought for 5 hours, and my tracker saying, no, you've been sleeping for 3. I was like, really? Sometimes you're sleeping, but you're tossing and turning and you're not really in deep sleep. Make sure that your room environment is conducive. You have good sleep hygiene. Turn off all the mobile devices and TV and blue light. Make sure you have the curtain that blocks all the lights. Don't drink before bed. You could be getting to use the bathroom, it's interrupted. Do a relaxing routine before, calming music, aromatherapy, stretches, journaling, any of these things. Meditate, exercise, and supplements that have shown to be good for some, magnesium and melatonin. Now, of course, you have to, during your annuals, you have to screen, ladies, okay? So talk to your provider about your menopausal symptoms if you can. And of course, any complications, any chest pain, any problems with the bones, any ache in the knees, any of those things. Of course, as you need to do your vitals when you go so your annuals are important. They check your blood pressure, your pulse, all of them relate to heart disease. Urine, see if any proteins in urine, that's an indication of renal disease, heart disease. Stool testing, give you information on any GI cancers. And your pap smears, cervical cancer, all of those things are still important. Your mammogram, those are important. But what is density testing? A lot of women don't. And if you need to supplement with anything to help decrease the risk of fractures. So some of the supplements women may know about, black cohosh. That is supposedly a very good, however, it's not been approved or for flashes, but women have used it for years, and some women said it worked. Black cohosh, ginseng, it helps with mood and insomnia. also may be helpful in small amounts. It does help, sorry, with the hot flashes. Any vitamins, the calcium, the vitamin E and D, those get us. The E supposedly gives some relief for hot flashes. But I think that's for mild hot flashes. That's not the first one I would choose. And of course, D3 and all of those are very good for bones. And then, of course, I mentioned earlier, magnesium and the melatonin helps with sleep. St. John's wort, any of y'all here but that? Oxymamine. Those are supposed to be good, very good and well known as a mood stabilizer, and it may be helpful with mood and sleep. And of course, things like evening primrose, again, these are some of the supplements that women have used in the past over years, and they have claimed these are helpful with some of their menopausal symptoms. Now, hormone replacement therapy, what is that? HRT. Well, basically, it is giving hormones in replace of your decreased hormonal levels, as I mentioned before. Now, back in the day, hormone replacement therapy was a no-no, but they have found, according to the WHI study, but they have found that the study was a little skewed, and they used synthetic hormones, all right, hormone replacement therapy, which was basically taken from horse urine. And so recently studies have shown that hormone replacement therapy in most situations, given, of course, you have to individualize the patient, is not as they mentioned back in early 2000s. Okay, so we're now back on the hormonal replacement therapy bandwagon. So of course, receptors, the various receptors that are in, if you have a decrease in your estrogen levels, it can cause things like hot flashes, the vaginal dryness, the mood changes, the thinning of the bones, and the heart disease. These are some of the effects that that may occur, and which estrogen hormone replacement therapy may be helpful. And again, these are the effects of progesterone deficiency, estrogen dominance, again, hot flashes, night sweats, insomnia, brain fog, bone problems, thyroid problems. All of these can be as a result. Now, we usually refer to progesterone deficiency and giving progesterone as the brain, as the body's Xanax. So anything that occurs mostly in the brain, mood swings, depression, brain fog, we tend to supplement with a small amount of progesterone. And of course, testosterone can kind of overlap with the two. So if you have a decrease in testosterone, one of the things I know is that your libido decreases. All right. And you have vaginal dryness, painful sexual intercourse. So some of the testosterone symptoms are kind of a bit of the two. All right. And so for that reason, you would give any of these hormone replacement therapies, whether it's estrogen with progesterone, but it depends on, for me, it depends on your labs. So you can't just go out there, you get this information and try to just supplement yourself. And we as Bahamians try to do that. And so there are various types of hormone replacement therapy. Oh gosh, I'm almost finished. They can come in any form: pills, tablets, patches, gels, creams, any of those things they now have available to us. So who can get it? Women who have menopause to prevent osteoporosis, and you just want to maintain a good quality of life with avoid of all of those symptoms, you may want to give hormonal replacement therapy. Now, first of all, of course, like I mentioned, give a questionnaire to assess for symptoms. Anywhere from 40, I start giving out my questionnaire in the office. We take a good medical history, your family history, any lifestyle changes you need to make. And of course, I consult with, I need to know where we're starting at. What are your estrogen levels? What are your progesterone levels and testosterone? And of course, you could do all of these things. I had a patient come in and the doctor didn't do sexual hormone binding globulin, which is the protein that takes around these hormones. And I told her, I said, well, listen, I can't assess these levels unless I know what those levels are. So make sure that that is done too. All right, and if seen anybody for your annual, make sure you bring those results along with imaging. Now, some of the side most of with estrogen hormone replacement therapy is the breast tenderness. And you may have some nausea, bloating, but the main is breast tenderness that I have been um, my patients complain of. And again, the same thing with progesterone, you may get some breast tendon headaches and dizziness. All right. Those are the main ones that most of my patients, but these are the other common side effects of those hormone replacement therapies. And again, for testosterone replacement, of course, you have weight gain, female man, pattern balding, acne. All right. So tips for patients who are on hormone replacement therapy, you have to follow up. I see my patients until I can get in a balance and we tweak a bit. All right, you have to report any of these side effects. Maybe we need to change, maybe we need to decrease. So you need to follow up, and I follow up my patients every 3 months in the beginning. Repeat your labs prior to follow up. I need to see what those are. So don't go off on your own, doing your own thing. All right. Do not adjust your treatment without discussing it with with your physician, and continue your lifestyle measures. These are non-hormonal treatments and they too have side effects. Antidepressants. All right. Prozac, Paxil, these are SSRIs that are used for vasomotor symptoms like the hot flashes. And the antihypertensive drug clonidine and anti-seizure drug Neurontin are also used as non-hormonal treatment for some of menopausal symptoms. And of course, I mentioned some of the supplements you would use for osteoporosis. Okay, any questions? I just rushed through. There's a whole lot more, but I'm way over time. Any questions?